Hola, vamos a continuar con la presentación de Jackie Rogers, a ver si conseguimos arañar algunos minutos. Cuando acabe, esperaros un momentito que tenemos unas cosas que contaros sobre la tarde y tenemos una pequeña sorpresa, ¿vale? Jackie es profesora de Psicología de Salud Mental en la Facultad de Medicina de Newcastle. Sus investigaciones están centradas en la ansiedad y el suicidio y especialmente están desarrollando medidas de evaluación para identificar las diferencias de salud mental de cara a que las intervenciones sean más eficaces. Han creado el primer cuestionario de ansiedad y suicidio válido para personas con autismo adultas que estén dentro del espectro. Además, dentro de la parte de la ansiedad, está muy interesada en el tema de la impredictibilidad. Y ella quería que resaltáramos que todo su trabajo lo realizan en colaboración con la comunidad autista, que creen que es fundamental esa coproducción y colaboración para realmente entender las experiencias que viven las personas. Os dejo con Jackie. Gracias.
Hola. It's a great pleasure to be here with you all today, and also congratulations on the 20th anniversary of this wonderful organisation. It's a real pleasure to be here to celebrate that with you. So I'm going to talk to you about autism and anxiety today. But first of all, a little bit about me. I'm a psychologist by background, but my research focuses almost exclusively on understanding the mental health experiences of autistic people, both children and adults. And I'm particularly interested in anxiety, and also more recently I've begun to do some work on suicide and self-harm. But today I'm going to be talking specifically about anxiety. I'll be talking to you about some assessment techniques that we've developed in our group in the UK, and also some interventions that we've been working on, all of which are freely available for individuals or on a no-cost basis. In addition, I just want to point out that in recognition of the expressed preferences of autistic adults, I will be using identity-first language during my presentation today. Okay, so let's think a little bit about autism and mental health. Well, there's now quite a significant research literature exploring the mental health experiences of autistic people. And sadly, what that literature tells us is that autistic people experience high rates of a range of co-occurring mental health conditions. Today, we're going to focus on talking about anxiety, but it's important, I think, to recognize that for autistic people, rates of depression, self-harm, eating disorders, suicidality are also elevated. And very often for these individuals, these difficulties may co-occur and interact with one another, creating a very complex mental health profile. When we're talking about anxiety in this context, of course, we're talking about an emotional state, which is characterized by feelings of apprehension and feelings of worry about the future. And it's often associated with physical sensations. So when you and I feel anxious, we may experience a racing heart. I had one a little while ago when I was waiting to come up here. We may also experience sweaty palms, feel a bit uncomfortable in our tummies, and feel muscle tension. And these are the signs and signals to us that we may be experiencing anxiety. And through our childhood, we learn to recognize these physical signs and symptoms. And that's really helpful to us because it enables us to say, okay, I'm starting to feel a little bit anxious. What might I be able to do to help? And that's something I want you to bear in mind as we're looking at some of the challenges that autistic people may experience in relation to anxiety. So the research on anxiety in autism is relatively new. It's probably been about 15 years since people started seriously thinking about mental health in autism separate from autism itself, and that's a really important development. If we pull together the evidence from this research, then we find that the rates of anxiety for autistic people are elevated to between about 50 to 70% of autistic people experiencing anxiety to the degree that it has an impact on their daily lives. But it's important to recognize that anxiety is not inevitable for autistic people. And it's also really important to recognize that when it is present, it is treatable. And that's a really, really important message. When autistic people experience anxiety, it can cause really significant distress, functional impairment. It will, of course, reduce opportunities and lead to poorer quality of life. Importantly, our work and the work of other groups suggests that when anxiety is present for autistic people, it's often quite complex in its presentation. So if you were to do a clinical interview to explore anxiety symptoms with autistic children or autistic adults, what you might find is that they will score above clinical threshold for multiple anxiety disorders simultaneously. So they may present, for example, with symptoms of separation anxiety alongside generalized anxiety, alongside social anxiety. And that's a real challenge from a therapeutic point of view. As a clinician, where do you start with someone who has a really complex anxiety presentation? So given all of these factors, it's unsurprising then, as we heard in Rebecca's talk about the mental health group yesterday evening, that anxiety and mental health generally are a research priority for the autism community. If we were again to go back to the published literature on anxiety, we would find some types of anxiety appear to be particularly prevalent for autistic people. So there's lots of evidence of specific phobias. Sometimes they're quite unusual in nature. There's lots of evidence for social anxiety for autistic people, and generalized anxiety is also frequently reported. But there is a problem with some of this literature. Very much of this research has been undertaken using anxiety tools and assessments that have been developed for neurotypical individuals. And they've been applied to autistic people without considering whether they are reliable and valid for the autism community. Recent research from our group and from others, particularly Connor Kearns in the US, suggests that for some autistic people, anxiety symptoms and their experience of anxiety may not be consistent with our kind of tried and tested understanding of what anxiety is, and may not be consistent with things like DSM or ICD-10 conceptualizations of anxiety. And indeed, anxiety may interact in complex ways with some autistic traits, which will serve to kind of promote development and maintenance of the anxiety for individual people. So this is an example of some work from Connor Kearns' group, and she was working a few years ago now in the US and developed a study using a gold standard anxiety clinical interview, the ADIS, with parents of autistic children. And she added some extra questions into her study to try and capture more autism-specific presentations of anxiety. And what she found was around about 1/3 of her sample presented with anxiety that was pretty familiar, pretty consistent with DSM understanding of anxiety. The second third of her sample presented with a combination of DSM-consistent and autism-related anxiety presentations. And the final group of children in her sample had anxiety that was very much related to their autism traits. And you can see on the screen there some of the ways in which anxiety was related to autistic traits for her sample. So the children would present with anxiety around routines that wasn't consistent with kind of generalized worry. They may present with highly unusual specific phobias. They had social fearfulness in the absence of worries about social judgment. And they also presented with anxiety related to kind of ritualistic behavior, but not in a kind of OCD type framework. So we're beginning to see the emergence of evidence that for some autistic people, anxiety may present somewhat differently from how we would ordinarily understand it. Given this, then, there has been the proliferation over the past few years of a number of anxiety-specific, autism-specific anxiety assessments, and I just want to share some of those with you now. So our group working in Newcastle were the first to develop an anxiety questionnaire with and for autistic children. It's called the Anxiety Scale, ASD, or ASK-ASD, as we abbreviate it to. It has a parallel version for parents and children, and it's validated for use with children above 8, so 8 to 16 years. Since its publication, it has been translated into a number of different languages, including Spanish, and there's a wonderful study that was carried out by some of your colleagues to adapt the ASK-ASD and evaluate its use in Spain, which I've put on the screen there for you. It's free to download from our website, so if you're interested, please take a look. Building on the work that I described earlier, Connor Kearns then developed an autism addendum for the Anxiety Disorders Interview Schedule, the ADIS, which is seen as the gold standard clinical interview for anxiety assessment for children. And this is a suite of questions which you would use alongside the ADIS if you were working with a family who had an autistic child. We've used her clinical addendum in a number of research studies, and we find it really, really useful, and families really like it actually, because it feels like we're asking questions that are relevant to them, and it makes sense to them. Larry Scarhill in the US has recently developed a parent-rated anxiety scale for autism. So there's no self-report for children from this scale. It's simply to be used with parents and provides a single anxiety score and has good reliability and validity for quite a wide age range. Working in Australia, the Macquarie Group have developed the MABS, and the good thing about this questionnaire, which is quite exciting, is it's been validated simultaneously with autistic children and neurotypical children. So if you're interested in doing a comparison study, then this would be a good tool to use, because it's been simultaneously validated in both groups, which most of the other autism-adapted scales have not. So Kearns talks to us a little bit about a framework that we might want to think about clinically if we're assessing anxiety in autistic children. And it's a 4-point framework that she thinks as clinicians we should perhaps be mindful of. Firstly, she suggests to us that we may want to consider the anxiety symptoms that we're seeing in the context of the child's developmental level, so what's appropriate for them developmentally. We would want to, secondly, assess whether their anxiety symptoms are causing significant impact for them, separate from, distinguished from their autism traits. And try, if we can, to differentiate anxiety from emotion regulation difficulties and sensory differences that may be present for the autistic child. And then finally, assess whether anxiety symptoms are in addition to the autism traits that we're seeing in the individual. Sounds simple, right? It's not. It's not a simple thing to do, but it's certainly something that we should really try and aspire to do when we're working clinically with this population. If you're interested in looking at this suite of anxiety measures that have been developed for autistic children, there's a really nice recent review paper by Lauren Moskowitz, which was published last year, which creates a lovely summary of all of that work. What about adults? I've just talked about children so far in relation to assessment. Well, it probably doesn't surprise you to know that we know less about anxiety for autistic adults, and there's been less work in that space so far. That's the case across autism research generally, I think. But there are some changes happening, and we are beginning to work more with autistic adults to understand their mental health experiences. A couple of years ago now, our group in the UK developed the first self-report anxiety measure developed alongside autistic adults, so co-produced with autistic adults and validated with them, and that's the ASA-A. Again, it has been translated into Spanish if you're interested and is freely available to download from our website. In terms of clinical interviews, there are no available clinical interviews or addendums currently to assess anxiety for autistic adults, but we are, in our group, working on trying to develop something along those lines, which we're calling the Personalized Anxiety Interview Supplement Autism, or PAIS-A, as we refer to it. It is a work in progress, and we haven't published these data yet, but we're trying to develop a set of questions that can be used alongside any clinical interview for anxiety, including the SCID or the MINI or others that are available, that actually tap into some of these more autism-specific anxiety triggers and mechanisms that autistic adults tell us are important to their anxiety presentation. We're using the PAIS-A at the moment in a feasibility trial, and we'll be able to report, hopefully, on the acceptability and feasibility of the tool in the next few months. And once we've done the analysis on the tool, again, it will be available from our website. So as we've heard today, particularly from Richard's talk, autistic people, and indeed their families, experience a range of inequalities, and of course that will impact on mental health. So when we're thinking about why autistic people may be more likely to experience anxiety, we can't forget the environmental context in which they live. And there will be very many external factors that will contribute to the development of anxiety for autistic children and adults. And I don't want to belittle the impact of those circumstances, but what I'm going to focus on in my talk today are some of those autism-related constructs that may serve to promote and maintain anxiety for autistic people. And I'm going to take you through a number of those constructs now. So first of all, we've heard a little bit already today about sensory differences and autism. And we know from a wide body of literature that at least 90% of autistic people report that they experience sensory differences and sensory sensitivities particularly. And there's a growing body of research looking at the impact of sensory sensitivities on the development of anxiety, which certainly suggests that sensory difficulties can promote anxiety and contribute to anxiety for autistic people. And furthermore, uncertainty about whether those sensory triggers are likely to be experienced in different contexts may lead to worry and anxiety about unfamiliar situations and settings, interacting therefore with uncertainty. We heard this morning in the first talk briefly about the presence of alexithymia for autistic people. And when we talk about alexithymia, what we're referring to is difficulties recognizing and understanding one's emotions, one's feelings. There's now a growing body of research which suggests that difficulties with alexithymia are associated with the presence of anxiety, and difficulties in identifying feelings are associated with anxiety severity specifically. And that makes sense. If you think back to when I described anxiety to you, we learn as we grow and develop to kind of recognize the early kind of signs that we're beginning to worry or we're beginning to feel anxious. And hopefully, as we grow and develop, we learn tools and strategies to try and manage our emotions. If as an individual you find it difficult to recognize your emotions, then that's going to make it difficult for you to use those tools and strategies in a timely way to reduce your anxiety before it's really escalated and is really, really high. So the association between alexithymia and severity of anxiety makes sense, I think, in that context. And given this relationship in the UK, our guidelines now suggest that one of the important stepping stones in supporting autistic people experiencing anxiety is to support them to develop more emotion awareness as part of a broader anxiety treatment program. In our group, we're particularly interested in the role that everyday uncertainty may have in the development of anxiety for autistic people. Autistic people often tell us that they experience difficulties and challenges in relation to changes in their routine, in relation to kind of unpredictable and uncertain situations. And the idea that uncertainty is associated with anxiety is not a new idea. It was first proposed in the 1980s by a group in Canada who were working with neurotypical adults experiencing generalized anxiety disorder. And this is the model on the screen that they developed at that time. And they identified a construct that they called intolerance of uncertainty. And they said that it was a very common construct in relation to generalized anxiety disorder. And people who experience intolerance of uncertainty find uncertain situations really stressful and upsetting and to be avoided at all costs. Since the initial publication of that work in the 1980s, there's been a wealth of research looking at the construct of intolerance of uncertainty. And it's now recognized as a really important transdiagnostic mechanism which contributes to a range of anxiety disorders, not just generalized anxiety, but social anxiety, separation anxiety, and indeed to a range of other mental health conditions, including eating disorders, for example. So our group were interested around about 8 years ago now in finding out whether intolerance of uncertainty was something that contributes to the development of anxiety for autistic children. And we published the first paper actually establishing that difficulties with uncertainty are an important factor in the development of anxiety for a number of autistic people. And that research has continued in our group, but also in others. So the second paper you can see there on the screen is a paper published just 2 weeks ago from Roma Vassa's group in Johns Hopkins. And there's a really nice meta-analysis published a couple of years ago now, which summarizes the research to date on the association between uncertainty and anxiety for autistic people. If you're interested in what this looks like in the real world, as it were, so if somebody has difficulties with uncertainty, how does that present? We published a paper recently which summarizes, it's a qualitative paper, summarizing the reports from caregivers of uncertain situations that cause daily difficulties for their autistic children. So you can get some kind of ideas about what this looks like in real life. The other construct I think it's important for us to think about when we're thinking about anxiety for autistic people is restricted and repetitive behaviors. Of course, a core feature of autism, but fluctuating within the individual. And we know from research that's been done by us and others that when autistic people are feeling anxious, we often see an increase in their engagement in restricted and repetitive behaviors. This may form a self-soothing function for them. It may also serve to make the world a more predictable and less uncertain place by engaging in things that are really, really familiar. An increase in an individual's restricted and repetitive behavior repertoire may be a particularly important sign that someone is feeling anxious if that individual uses few or no words, and it may be something really worth asking parents and caregivers about during a clinical assessment. In addition to that, the kind of less flexible thinking style that some autistic people experience may make them more likely to be kind of stuck in anxious ways of thinking and find it more difficult to kind of generate alternative solutions to problems that they may find themselves in. So we've looked a little bit at assessment methods, and we've looked a little bit at kind of autism-related constructs. Let's now think a little bit about psychological therapies for anxiety for autistic people. Well, a kind of an overview of the literature would alert you to the fact that psychological therapies for anxiety have kind of demonstrated mixed levels of effectiveness to date. And it's important to acknowledge, as I think Jonathan did this morning, that the research literature and the large clinical trials looking at psychological therapies for anxiety and other mental health conditions in autism are lacking. So we really need to make some significant progress in this domain. To be acceptable to autistic people, it's very important that mental health services are adapted to meet the individual's needs. And I would argue that there's two ways that this adaptation needs to occur. We need to think about common sense, basic, essential adjustments to improve access and engagement by autistic people, as Richard mentioned in his talk. But I would argue that we need, as a community of clinicians and researchers, to go further than this. We need to think about how we adapt psychological therapies from a theoretical perspective and take into account autism-related anxiety mechanisms like difficulties with uncertainty and alexithymia. Having said that, there is some emerging evidence for the effectiveness of adapted CBT for anxiety for autistic people, with the acknowledgement that the studies are relatively small. And there's some growing evidence for the use of mindfulness. Indeed, I saw a lovely poster yesterday on mindfulness work with autistic people. And there's a great review paper by Susan White, if anyone's interested in kind of looking at the evidence base to date. In terms of those practical adaptations, most of the guidance is in relation to work with children, but some of these principles would apply to adults too. So these are some of the things that would be advocated. Given the difficulties with emotion recognition and understanding, Emotion recognition training before formal therapy might be really helpful. That's going to help someone to begin to recognize when therapies are becoming effective. If you engage in CBT or other psychological therapies, they don't just switch your anxiety off. It will decline over time, and you need to be able to recognize those small changes in your emotions. If accessing that information is tricky for you, you might give up because you can't feel that it's making a difference. So emotion recognition training can really help with engagement in therapies, as can mindfulness to address anxiety sensitivity and distress intolerance. Most of our anxiety treatments involve some form of graded exposure. If you are really sensitive and anxious about feeling anxious, it might be difficult for you to engage in that type of therapeutic work. So strategies to help with that engagement may be really helpful. From a kind of process perspective, using concrete, structured techniques, lots of repetition, video modeling, all those sorts of techniques make common sense, I think. Involving parents, carers, loved ones in the therapeutic journey can be really helpful to promote generalization of strategies and techniques outside of the clinic. And incorporating interests into the work that's done within the session will increase engagement and motivation. So there's some of the practical techniques that we may all think about using, but let's circle back to some of these theoretical adaptations that I mentioned. And to illustrate what that might look like, I want to talk to you about some work that we've been doing on uncertainty. So a few years ago now, a group in the US, led by Judy Reaven, were doing an evaluation of a very well-known manualized intervention for autistic children experiencing anxiety called Facing Your Fears. And having seen our work on intolerance of uncertainty, they were interested to determine whether uncertainty predicted treatment outcome in their intervention. So they assessed difficulties with uncertainty at the beginning of their trial. And what they found was that for the children who participated in their intervention, higher levels of pre-treatment intolerance of uncertainty predicted higher levels of worry at the end of the treatment. And so what their findings suggest is that perhaps a well-established program like Facing Your Fears, which doesn't address difficulties with uncertainty, perhaps is not tapping into some of the mechanisms that are driving anxiety for autistic children. And that perhaps targeting responses to uncertainty may improve outcomes, particularly given that intolerance of uncertainty is a transdiagnostic mechanism. So it's feeding into all of these different types of anxiety that we see in autism. So a few years ago now, we began to develop an intervention which specifically targeted this uncertainty mechanism for autistic children experiencing anxiety. And the intervention is called Coping with Uncertainty in Everyday Situations, or CUES as we refer to it. It's a parent-mediated intervention, so like PACT and the other interventions that Jonathan was talking about this morning, we work with parents. We don't work at all with young people. The parents come to groups, and there are eight sessions in the intervention. And together, parents work on trying to develop skills and strategies to support their autistic child in relation to the anxiety they're experiencing about everyday uncertain situations. And we've just published a feasibility and acceptability trial on the CUES program. So the principles behind CUES then are that as much as we may want to, as parents, as therapists, we can't make the world an entirely certain place for our children. It's just not like that. So what we can try and do, therefore, is we can try and increase the child's ability to tolerate everyday uncertain situations, to give them skills that will hopefully reduce reliance on strategies like avoidance and over-preparation, which actually serve to promote the idea that uncertainty is really scary and something to be avoided. So what the CUES program does is that it tries to increase tolerance to everyday uncertainty through the use of gentle graded exposure techniques delivered by parents in between the sessions. And our recent acceptability and feasibility trial suggested that our CUES program was acceptable to parents and could be delivered by general clinicians working in our National Health Service and was safe to deliver. We do have some very preliminary evidence of improvement in functioning in everyday uncertain situations identified by the parents who took part in the study. However, importantly, it's really important to recognize that where the evidence is at the moment, our study wasn't a fully powered trial. So we can't make any grand claims, unfortunately, about clinical and cost effectiveness. So what about adults? So we've been working also on trying to develop an autism-specific intervention for autistic adults experiencing anxiety. And this program is called the Personalized Anxiety Treatment Autism, or PATE, as we talk about it. PATE involves a really detailed assessment and formulation of an autistic adult's anxiety profile, followed by the development of an individualized treatment pathway which identifies access to a number of different treatment modules. So, for example, an autistic adult who has difficulties with anxiety in social situations and also really struggles with uncertainty may have a treatment pathway that includes our adapted CBT for social anxiety alongside CUES adult. Some individuals who have difficulties with alexithymia may also get our module on understanding and describing emotions. We've just finished data collection for a feasibility and acceptability trial for PATE, and we're busily analysing the data at the moment, and we hope to publish some of these data early next year. So we've talked about practical adaptations and theoretical adaptations to anxiety treatments for autistic people. But even the most cutting-edge therapies are not going to be effective if we can't get people into the clinic room or we can't get people engaged with therapy. And it's really clear to see that autistic people need access to effective healthcare. And unfortunately, very many autistic people do not get good access to effective healthcare. Shockingly, absolutely shockingly, autistic people's average life expectancy is around 12 years lower than that for neurotypical people. And a lot of that will be captured in this differential access to healthcare, some of the health inequalities that Richard was talking about earlier. We know now from evidence that many autistic people face significant disadvantages to healthcare access. And if they do gain access, their engagement and satisfaction with services is poor. And consequently, treatment outcomes are also poorer. And so, unsurprisingly, improving all aspects of healthcare for autistic people is a research priority for the community. We've recently published a paper in the UK based on a large survey with autistic adults, looking at the importance and availability of adjustments to healthcare services to improve access, both in kind of physical health and in mental health. And I want to share some of the data with you from the mental health aspect of this survey. So we asked autistic people who'd experienced trying to access healthcare services for help with anxiety, what their experiences were like. And as you could see from the graphs there, a large majority of them felt that their treatment was not helpful and that the service wasn't adapted to meet their needs. And when asked whether service adaptations were appropriate, they said no, but it would have been helpful. That was the majority voice coming out from this survey. When we asked autistic people in the survey, just to give us in their own words some ideas about about what those adaptations may have looked like, you will see from the screen there that it's not really complicated, sophisticated, expensive changes that people are asking for. It's quite common sense things. You know, thinking about the timing and the sensory environment, the timing of appointments so that people are not traveling in peak hour traffic to get to an appointment. Thinking about the sensory environment in the clinic and whether that could be managed. Using clear and effective communication. Autism training for healthcare professionals. When we asked autistic people what some of the barriers were to accessing healthcare, they provided us with a really comprehensive list. Effective communication between and by healthcare professionals was often perceived to be poor. Their sensory differences were not considered in ways that would make them feel comfortable in a healthcare setting. Very many health professionals they encountered had no or very little knowledge of autism, and complex referral and treatment pathways, which often changed at short notice, were seen as very, very common. So in summary then, just to think a bit about what we've been thinking about together today in relation to anxiety and autism, what can we conclude? Well, sadly, anxiety is a very common experience for autistic people. And when anxiety is present, it is often harder to spot using traditional measures developed for neurotypical individuals. When anxiety is experienced, it may be complex and multifaceted for autistic people. And transdiagnostic constructs like intolerance of uncertainty and alexithymia may play really important roles in maintaining anxiety and therefore need to be taken into account in treatment planning and the development of therapeutic approaches for autistic people. The interventions themselves and the support around those interventions in services needs to be adapted to make them suitable, inclusive, and accessible for autistic people. And the systemic barriers to healthcare that we see really need to be addressed so that we can serve autistic people that we're supporting much better than we currently are. Thank you very much for your attention.
Bueno, muchísimas gracias a Jackie. La verdad que ha sido una ponencia muy reveladora, muy interesante, llena de herramientas. Así que creo que vamos a tener muchas preguntas para ella para la tarde. Recordaros algunas cosillas de organización. Vamos a intentar comenzar, porque vamos prácticamente en hora, a las 3 de la tarde. Aquellas personas que presentan comunicaciones, ya habéis pasado algunas de vosotros la presentación. Los que no, intentar estar a las 3 menos cuarto, puesto que de 3 a 4 tenemos el encuentro con los ponentes y seguidamente van las comunicaciones. Si habéis visto un poco el programa, cada bloque de comunicaciones en las distintas salas es un poquito diferente. Eso significa que cada sala hará el descanso más o menos a una hora parecida, pero no exactamente igual. Lo digo sobre todo porque hay veces, ¿no?, que nos ha gustado cambiarnos de una sala a otra. Entonces, pensad que a lo mejor no van a coincidir exactamente los descansos, ¿vale? También habéis preguntado por las presentaciones. Cada uno de los ponentes nos está pasando distintas presentaciones, os las haremos llegar, ¿vale? Lo que nos pasen os lo haremos llegar en los próximos días. Y hay una última cosa, nos gustaría hacernos una foto de grupo, ¿vale? Entonces hay personas que delante de vosotros tenéis pegados en la parte de atrás del respaldo de las sillas una cartulina. Los que tengáis eso, nos gustaría que lo despegarais y que alguien encuentre alguien tiene que encontrar. Ah, muy bien, ya. I'm telling them that they have like these little flyers, hide them, because we're going to make like a photo all of us. Yeah. Vale. Necesitamos encontrar uno que tiene además el logo de AETAPI y que está en verde. Pues esa persona es invitada a salir aquí con nosotros y si le apetece, hacer un selfie con toda la sala. Y si no te apetece, puedes cederle a alguien que le apetezca cerca de ti, ¿vale? Venga. Okay. We need to go down because he's going to make a selfie, so we want to be in the photo.
Nos saludamos, ¿no? Porque, claro, ahora sí.
Vale. Pues disfrutar de la comida y nos vemos a las 3.